Hello. Welcome to the Pars Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about the 8 acid reflux natural remedies. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. Acid reflux is a digestive problem most people have experienced. It has affected many people in their lifetime. There is no limit in age. It can engage individuals at any age from infants to older adults. It happens when the muscle at the bottom of your esophagus, called the lower esophageal sphincter, releases stomach contents to flow upward. There are many remedies for this problem, such as medication, but if you are a fan of natural remedies and prefer not to use chemical medication as possible, stay tuned with us. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. What is acid reflux? Acid reflux, medically known as gastroesophageal reflux or GERD, occurs when stomach acid and food or liquids come back up into your esophagus. It can be a random or temporary problem, or you can have repeated symptoms in the form of a chronic condition called gastroesophageal reflux disease GERD. Feeling heartburn is one of the symptoms that is very common for this disease. You may have it after eating an especially big meal. Around 20% of people in the US have experienced GERD. Special diets can trigger acid reflux, and it is also more likely to harm pregnant people and those with asthma or excess body weight. If acid reflux happens repeatedly, a person may have gastroesophageal reflux disease, GERD, which can cause difficulties in the long term. Anyone who is concerned about their symptoms should speak with a doctor. Here's a list of natural remedies you can do. Number 8. Incorporate ginger into the diet. Some research implies that ginger may be effective for nausea, vomiting, and other symptoms. Based on the existing evidence, researchers recommend a daily dose of 1,500 milligrams of ginger. It is possible that a larger consumption could have opposing effects. Ginger is an easy ingredient to combine within the food. You can try adding it to hot water to make ginger tea, including it in a stir-fry, boiling it in a soup, grating it raw onto salads or cereals. People who dislike the taste of ginger can mask it by including it in recipes with other strong flavors. Number 7. Maintain a healthy weight. Eating a well-balanced diet is important for a person's overall health, and it can also aid them to control their weight. 74% of all adults in the US are overweight or have obesity. The Obesity Action Coalition says that acid reflux happens more commonly amongst grown-ups who have a high body mass index, BMI, or obesity. The reason for the connection appears to be that excess fat around the abdominal area puts tension on the stomach, making the body work harder to maintain acidity down. People with a high BMI may find that reaching and maintaining a moderate weight helps them lessen the repetition of acid reflux. It is essential that people concentrate on safe ways to lose weight, as losing too much weight too fast may also create health problems. Number 6. Chew sugar-free gum. A study has proved that chewing gum can improve eating frequency, increasing the clearance rate of reflux in the esophagus. Chewing also boosts saliva production, which helps neutralize stomach acid. However, it is necessary to avoid chewing gums containing sugar, which may produce the symptoms worse or cause dental erosion. People should also avoid mint-flavored gum, as mint can worsen the symptoms of acid reflux. Number 5. Don't drink too much coffee. Studies prove that coffee temporarily weakens the lower esophageal sphincter, enhancing the risk of acid reflux. Some evidence shows caffeine as a possible culprit. Similar to coffee, caffeine weakens the lower esophageal sphincter. Additionally, taking decaffeinated coffee has been shown to reduce reflux compared to regular coffee. However, one study that provided participants with caffeine in water was incapable of detecting any consequences of caffeine on reflux, even though coffee itself worsened the symptoms. These conclusions show that compounds other than caffeine may play a role in coffee's effects on acid reflux. The processing and preparation of coffee might also be involved. Nevertheless, although several studies recommend that coffee may worsen acid reflux, the evidence is not entirely conclusive. Additionally, an analysis of observational studies found no significant impacts of coffee consumption on the self-reported symptoms of GERD. Whether coffee intake worsens acid reflux may depend on the individual. If coffee gives you heartburn, simply avoid it or limit your intake. Number 4. Limit consumption of carbonated beverages. Patients with GERD are sometimes recommended to restrict their consumption of carbonated beverages. One observational study found that carbonated soft drinks were connected with enhanced acid reflux symptoms. Also, studies report that drinking carbonated water or cola temporarily weakens the lower esophageal sphincter, compared to drinking plain water. The main reason is the carbon dioxide gas in carbonated beverages, which causes people to belch more often, an effect that can develop the amount of acid escaping into the esophagus. Number 3. Elevate the head of your bed. Some people experience reflux symptoms during the night. This may disturb their sleep quality and make it challenging for them to fall asleep. One study showed that patients who raised the head of their bed had significantly fewer reflux episodes and symptoms, compared to those who slept without any elevation. Additionally, an analysis of controlled studies concluded that elevating the head of the bed is an effective strategy to reduce acid reflux symptoms and heartburn at night. Number 2. Don't sleep on your right side. Several studies show that sleeping on your right side may worsen reflux symptoms at night. The reason is not entirely clear but is possibly explained by anatomy. The esophagus enters the right side of the stomach. As a result, the lower esophageal sphincter sits above the level of stomach acid when you sleep on your left side. When you lay on your right side, stomach acid covers the lower esophageal sphincter. This increases the risk of acid leaking through it and causing reflux. Obviously, this recommendation may not be practical, since most people change their position while they sleep. Yet resting on your left side might make you more comfortable as you fall asleep. Number 1. Keep a diary. Keeping a diary and tracking when acid reflux occurs can help a person feel more in control of their body. Alongside their symptoms, they can note the foods that they have eaten and any changes to their behaviors or habits. This approach can help a person identify any triggers for acid reflux, which they can then avoid where possible to prevent acid reflux from recurring. However, triggers for acid reflux vary from person to person, and they may not always be obvious. If someone is unable to identify and eliminate factors that cause or worsen acid reflux, or if they have concerns about their symptoms, they should contact a doctor. They may have GERD or another health condition. A doctor can diagnose the issue and help them devise a treatment plan. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.